Okay, well, welcome again to our May 2021 Zoom meeting. And first of all, I must acknowledge the passing of Bill Johnston on May 7th. Bill was a member of the Burlington Provost Club from 2011 to 2019. So in Bill's memory, please join me in a moment of silence. Thank you. Before we move on to our speaker, I want to mention that your management team has been considering how we will return to in-person meetings once the health guidelines allow us to do so. We're looking at the feasibility of having hybrid meetings, that is, using Zoom in conjunction with our meetings at the Art Gallery. And more information is going to come out in the June newsletter. And that is all I will present today. And so now I'm going to pass the gavel over to Kevin to introduce today's speaker.
Thank you very much, Ken. Good morning, everyone. It's my great pleasure to introduce our speaker today, Dr. Dale Kalina. Dale is a local boy. He grew up in Oakville. Actually, our families lived on the same street for a while. That was a while ago. He attended Appleby College. He's a proud alumnus of that school. After medical school, he specialized in internal medicine and infectious diseases. And he's now an adjunct professor, assistant professor of infectious diseases at McMaster. He teaches there. He also actually has a business degree, which is a bit unusual for a doctor. He has an MBA, or they call it now an EMBA, in digital transformation. Dale, digital transformation. That sounds great. From the DeGroote Business School. Currently, he is the pandemic team leader here at Joseph Brant Hospital in Burlington. And Dale is our local expert, really, on COVID and on the pandemic. And as well as that, he's something of a media personality. We found that out, and you may have seen him. People walk up to him all the time now and ask, haven't I seen you on TV? Is that right, Dale? I think it is. So we're delighted to have him with us here this morning. And just before he begins, I do this occasionally. I know I bore people, but anyway, I'd like to share a personal story. It's a COVID story. We all have COVID stories. This is about my son, Sean. He works in a homeless shelter in Toronto. He's a supervisor there. And after a night shift about a month ago, he wasn't feeling very well, feeling quite sick. He had a number of COVID-like symptoms. He had a headache, he had a bit of a cough, and he was worried. And so he was very anxious to get a COVID test because this particular shelter that he works in had been hit with several COVID outbreaks, not just affecting the clients, but also the staff. In fact, his boss had gone down with COVID. So as soon as he got home, he logged on to the Holton website. That was at about 5 to 8 in the morning. And by 8:20, that's in less than half an hour, he had an appointment to go for a test at Joseph Brant. And he got his result actually later that same day. Thankfully, it was negative. So that's a pretty quick turnaround. So Dale, I want to say a big thank you to everyone involved in the testing. And I also for all the great vaccination work being done in Burlington and Holton. I actually had my shot at Joseph Brant and it went very smooth. I was in and out in 25 minutes. A great system you have there. Anyway, now for our topic this morning, one we're all very keen to hear about, and that is what does the future hold for us at this point, at this stage in the pandemic? So Dale's going to talk to that. His talk is entitled COVID-19 in Burlington, Where Do We Go From Here? And after Dale has finished, there'll be lots of time for Q&A. I'm sure there's going to be a lot of questions, so please have your questions ready to go. Okay, that's me done. Over to you, Dale.
Thank you so much, Kevin, for that kind introduction. And I'm also glad to hear that Sean is doing okay, and such good work that he's doing, especially in the homeless shelters right now as well. It's been a particularly difficult time, especially for people who have kind of tenuous housing and things like that. And I think that sometimes that gets brushed under the table a little bit as well. So I'm just so happy to hear that that he's doing all that hard work. So as my screen starts to get shared today, well, let's see if I pop up. There we go. Can you guys see me? Can you hear me? Looking for maybe Kevin. Can you give me a thumbs up if you can see or hear me?
You're all good, Dale.
So as Kevin mentioned, I'm very happy to be here today, and I'm really excited to be able to speak with you all a little bit about what COVID has been like here in Burlington and in Halton region, and really where we go from here. So I'm going to tell you a little bit about that, a little bit about myself, and then, as Kevin alluded to, lots of time to answer questions afterwards, which is something that I'm really looking forward to as well. So as you can see behind me here, this is the view from Joseph Brand Hospital. Actually, I like to tell our patients that if they squint, it looks kind of like they're in the Bahamas. It almost looks like Bob Dixon's background right there as well. So well, maybe I'll get out of the way of myself here. So as Kevin has alluded to, I wear a few different hats. So I did indeed grow up in Oakville. I'm from around here, and I moved back after living abroad. Actually, I lived in the Czech Republic for a while. I lived in Saskatchewan, which is where both sides of my family are from, the Czech Republic and Saskatchewan. And now working here at Joseph Brand Hospital, and I live in Oakville. I work as our infection prevention and control medical lead for all of 2020, which is why I wore that hard hat you can see above. And that's as we were constructing our pandemic response unit, which I'll talk a little bit more later about. I'm also an actual doctor. I see patients, I see people in the hospital, and that's the picture of me in my face shield and my mask there was me on, I think it was New Year's Eve or Christmas Eve this year, working overnight at the hospital. And a more recent, maybe unexpected turn of events is that, as Kevin has alluded to, I guess I've become somewhat of a media personality. So I do get the opportunity to share my thoughts and opinions on what's been happening in our community with respect to COVID and where we go from here. So I'm really excited that I do, and my colleagues and friends also get the opportunity to help, dispel rumors and myth, and help make a little bit of a better understanding, I think, of where we are and really what has been a frightening time, I think, for everybody, myself included, and a very difficult time for our entire country. So this is a graph of what we're currently living in Halton, and I'm going to show you Burlington in just a second. But right at the very end, kind of right above here, you can see that we've peaked in terms of the third wave, thank God. And also the darker color that you can see on the graph are those variants of concern. And we're seeing the same sort of thing here in Burlington as well, that the third wave, and we can see those distinct peaks here. Burlington was a little bit different than Halton region, of course. You can see the three distinct peaks in Halton much more easily than Burlington, where our second wave kind of waxed and waned. But we are starting to come off of that, which is really nice. And it is the result not just of hard work of us in the healthcare industry, but of hard work of everybody, like I say, on the front lines, and that's all of you. The work that we do in the hospital wouldn't work if not for the fact that you are all staying at home, wearing masks, distancing, washing your hands, and of course now getting vaccines. And that's why we're able to get on top of the case counts that we have been experiencing. That's also how we've been able to pull away from the brink in terms of primarily ICU capacity, not just at Joseph Brand Hospital, but across the entire province. So where we are in Halton right now is that we are having far fewer cases on a daily average. As you can see in the top left there, we're at about 76 cases per day on a 7-day average. So that's come down from where we were around 200 a day, actually at one point in the third wave, and that's the highest we've ever been. In the bottom left is actually one of the things that I think we can all be most proud of, is that we have currently 5 institutional outbreaks, but you can see that peak. And that was through January, where essentially all congregate care settings, so retirement homes, long-term care homes, were an outbreak. And with the 5 outbreaks that we have right now, all 5 in Halton region, I think there's 2 in Burlington right now, are actually staff members. I can't tell you their vaccine status officially, but they don't involve residents of long-term care homes. The people that are vaccinated that have been involved across Ontario in long-term care home outbreaks are now completely asymptomatic. And that brings a sharp contrast to what we saw in the second wave. And that's what this graph here shows. When you look, let me see, in this one up here, if you can see me pointing, in that one right up there, that dark black kind of graph there is people that are over the age of 80. And frankly, it was a lot of people in long-term care homes and congregate care homes that were seeing that spike. That's also what we saw way back in the first wave as well. And we know that people in the first and second wave that lived in congregate care bore the brunt of this pandemic, which is heartbreaking. There were many people that lost their lives and many families that have been grieving as a result of that. But you can see right up in here, you can see I'm fiddling around with this new camera technique. In this wave here, in this third wave, it's turned on its head, which is all the result of vaccines. So you can see people that have not yet had the opportunity to have vaccines are at the top of that range, and that light blue color, and that's younger people. While at the same time, people who got their vaccines earlier on, so primarily 80 plus, and then also 60 to 70 to 79, are at the lower range of the outbreaks. And that just goes to show how well all of these vaccines have worked in our own communities here. It also speaks to how our healthcare system has been able to get on top of managing cases as well. At the same time, oh, sorry, I just need to respond to something here quickly. There we go. The healthcare system is getting better at being able to respond. When you look at that 79% ICU bed capacity, we're actually over 100%, but that baseline keeps changing a little bit, because at Joseph Brand Hospital, for instance, and at Hamilton Health Sciences in Oakville, at Halton Healthcare in Oakville, have actually been able to expand the ICU capacity. So that 79% is based on the new baseline, and that's why it looks so low. We're actually functioning at our peak. We were functioning at 160% capacity of our baseline in our ICU, which goes to show that not only were we able to do all sorts of what I'll say is creative things in terms of expanding capacity, but it also shows the limits to which we were strapped and the difficult measures that we had to undergo to be able to help people in more strapped jurisdictions, particularly in Peel, York, and Toronto, but really how the healthcare system in total has been able to brace for this and has been able to adjust, is what that 79% represents. Now for a little bit of good news, is that we in Halton, in the entire population, and this is not just eligible people, but the entire population of Halton, is sitting at 55% of people who've already received at least their first dose. It's just a first dose. It is getting better and better, but it is a good number. And that's why the numbers in Halton region have started to get better. For those of us who have been, or sort of those who have been infected after they've had a first dose, anecdotally, people are doing much better. And we don't see people in the ICU or in the hospital who've already had a dose and are past, particularly the first few weeks after their dose, when the immunity from that dose has already set in, which is really great news. And I know we'll be able to talk about that a little bit later. But in calls that we make to individuals who have unfortunately become positive, the people, once again, who've already been vaccinated have no symptoms. And that is what I'm encouraged by. When I've heard people talking about these vaccines, primarily in terms of what they can do, being that they turn COVID into a cold. And I'll be blunt, I don't care if you get the sniffles from COVID. I care if you can't breathe. I care if you have to come visit us in the hospital. I care if we have to intubate you. And I care if it's going to result in your family members having to grieve for you. That's what I care about. If you get the sniffles, that doesn't matter to me. And that's what we see for people who've had the vaccines. Every age range, so on the Halton website, we subdivide by 5 years. So every age range over 45 has over 50% vaccines. Every age range above 50 has over 65% received their first vaccines. And if you look at the older age ranges over 80, 75 and over 80, that's very close to 90%, which is exceptional. And that's why we are where we are, is this group effort to be able to get as many people vaccinated as possible. So what have we done at Joseph Brand? So this is a picture from way, way back when. This, I think, was actually from over a year ago at Joseph Brand Hospital, and one of our first iterations of how we screen people. So when you do come into the hospital, everybody gets screened for exposures, for symptoms, and now for vaccine status as well. This is one of our earlier iterations. We've got what I'll call more robust screening stations now, but it goes to show what we've been referring to as the new normal for quite some time now, is subdividing our population and subdividing the level of risk that people have based on vaccine status, based on exposures. And that's what we're going to, I think, continue to see more of, not just within the healthcare system, but as we're going to start to see later in the day today. Actually, right after this, I believe the Premier of Ontario is going to be speaking in a press conference to announce what Ontario will look like as it opens over the next few months. And in actual fact, I think I have to be a talking head on TV to talk about it afterwards too. So this is what we're going to start to see more of, is what you can and cannot do, not only locally, but internationally, based on what you've been exposed to and your vaccine status. We're already starting to see that in the United States. We heard about what this is going to look like in Europe in terms of travel to Europe as of yesterday, that it was announced that people who've had their full course of vaccines will not need to quarantine when they arrive within the European Union. And this is the type of thing that we're going to start seeing as we move forward. So I like to show people, and this is not just because I keep my passport right here, is that I myself, you can see my passport here. I myself in my passport keep not only my, as you can see, my yellow fever vaccine card, which is the precedent for vaccine status. So you can't travel to about half of the world without a yellow fever vaccine card. So I used to live in Kenya, so that's why I have mine. And this is my vaccine card. I keep that right there in my passport. And that is something that in the interim, before we do have some sort of electronic version of that, that's something that I recommend to people, because it shows that you have your vaccine status and you don't need to do things like quarantining. Other things, of course, that you've heard at Joseph Brand Hospital, we opened the pandemic response unit that right now we are using for vaccines, but we've had to use in the past for inpatients as well. And that just goes to show the level of inpatient status that we had, the number of people that we had to care for. And having this field hospital developed, and of course, we were one of the first field hospitals to have built to have been built in Ontario, followed by Trillium Health Partners in Mississauga, and more recently by Sunnybrook Hospital in Toronto and Hamilton Health Sciences in Hamilton. But we really were on the forefront of being able to wax and wane with our community's needs. So we're happy that we've been able to use this for a number of regional resources and for vaccines right now as well. And this is what it looks like inside. So when people have called it the tent, it really looks nothing like a tent inside. I think it was Kevin, you mentioned that you'd been vaccinated within it, and it's a pretty advanced structure, I have to say. And these are the beds and everything like that. So it is a fully fledged field hospital inside. That's actually pretty comfortable. But as I've said, we've been using it for whatever we need to use it over the course of the past year. We also, in various iterations, had to close down different areas of our hospital for testing centers, which we continue to operate. This was actually my old clinic that we cordoned off and made into one of our initial assessment centers. And as a result of that, I'd like to just highlight some of the other things that we've been able to do, not only in Joseph Brand, but across the healthcare system in general. And this is a picture of myself in the early days before clearly I lost the way to any barber shops. But this was my virtual care team. So in the early days when my clinic was shut down because of this, we went entirely online. So we had virtual clinics, video conferencing, text messaging, telephone calls. We had a lot of different opportunities to be able to make access to care uninterrupted for people. So if you've had a doctor's appointment or anything in the past year, many of you will have experienced this. So not just different virtual care techniques, but also different ways to be able to access healthcare without physically being there in person. And that is what Kevin was alluding to in my introduction of what digital transformation is. So that is my business raison d'etre. But that is what I was also able to help bring to Joseph Brand Hospital, and what we across our healthcare system in Ontario have been able to manage as well, to allow for people to experience healthcare in a safer way, and in a way that it's not just for a pandemic. I mean, at the end of the day, one of the benefits is that you don't have to pay for parking at the hospital. Believe me, I know that. But at the same time, if you have any accessibility issues, if you can't leave the house, if it's difficult, or frankly, if you are traveling perhaps, some of us will be able to access care to our physicians and our healthcare partners via virtual means. It's also meant that mental health programs, for instance, at Joseph Brand Hospital throughout the pandemic, first of all, we're not inhibited by the pandemic, and we're actually able to expand, which really goes to show the different innovative techniques that have been used across the board, not just in infectious disease, but also in internal medicine, in psychiatry, and in surgery, to be able to expand the resources that we have available to our community. So this pandemic has affected, of course, every aspect of everybody's lives. I know we're here to talk primarily about vaccines and about where we go from here, but this is part of it. Part of the silver linings of this entire pandemic has been the ability for us to think creatively about how we provide care to our community, how we use virtual care, and how we look out for one another. So with that, I look forward to answering a few questions and discussing where we are and where we go from here. And although I'm not Anthony Fauci, as you can see, my dog Lloyd, he's particularly interested in what Dr. Fauci has to say, but hopefully I'll be able to answer your questions just as well. Thanks again for having me, and I'm really looking forward to our discussion.
Okay, thank you, Dr. Kalina. And what we're going to do now is move into Q&A. And if you have a question, raise your hand. Gary will keep an eye out. And when he says it's your turn to ask a question, take yourself off mute, pose your question, and then go back on mute. Okay? Take it away.
Okay, I can only see about half the people at one time, so keep your hand up if you do put it up. I see Chris Walker, go ahead. Unmute yourself.
Thank you, Dr. Kalina. That was a very interesting, presentation. One of my concerns has been the interval between first and second shots. And I'm wondering if you share my hope that maybe this is going to be made a lot closer than having to wait 16 weeks.
Thanks, Chris. I think that that's a really great question. And you're very right. It's caused a lot of, I'll say, consternation over the course of the past several months, at least. So, I mean, at the outset, I will say that the decision to delay second doses of the vaccine could not possibly have been an easy decision to make. The recommendation from the National Advisory Committee on Immunizations, NACI, of course, made the recommendation to delay first doses to 4 months, which was a decision that was made based on how we know vaccines work. And usually vaccines are actually administered. You get a primer dose, and then about 6 months later, usually you get a secondary dose. The studies to validate how well primarily the Pfizer and the Moderna vaccines work were, of course, conducted at 3 and 4 week boosters, respectively. And those, I think, were done for a variety of reasons. Number one, and least in a least jaded response, the reason why they were done that way was to make sure that we could get upfront immunity as quickly as possible. And that's what you get by pushing the first 2 doses closer together. But the reason why that needs to be validated is because it is an unorthodox approach. We don't usually dose people with vaccines within a 3-week time frame. So it needed to be validated that it even worked, while at the same time recognizing that Pfizer and Moderna are organizations that want to make money and want to sell product as well. So if you push together the first 2 doses really close, you sell more upfront. And that's exactly what they did. At the same time, we know that if you delay second doses, you probably would get a stronger immune response. And since that decision has been made, that's actually been validated in a study that was published about 2 weeks ago. And that was based on the UK experience. So the United Kingdom also delayed their second doses of vaccines in an effort to give more first doses to the wider population. So it found 2 things. Number one, a delay in the Pfizer second dose actually improved immunity, which is really great. But number 2, because of vaccinating more people with the first dose, it saved lives. And without a sliver of a doubt, when you are in a situation, as we were and as the United Kingdom was, of not being able to vaccinate everybody at once, the better decision was to be able to vaccinate more people with the first dose. Without a doubt, it saved lives. Without a doubt, it will actually lead to improved immunity. But I will say, candidly, I am really looking forward to when everybody will be able to get second doses. And because of the supply of vaccines that we've seen, especially over the course of the past few weeks, and looking forward to the next 2 months, I believe we're expecting kind of 9 or 10 million vaccines at least. I'm expecting that it's going to be moved up. Already in Halton Region, if you meet a number of criteria, you can already apply to have an exemption of your second dose delay. Yeah. In direct terms, if you are over the age of 80, if you have cancer, if you're on immunosuppressive therapy, or a variety of other conditions, call 311 or visit the halton.ca website. You can apply to have your second dose now, which is something that I could not possibly encourage enough.
Yeah, I've been fortunate. Sorry, I've been fortunate enough to do that because I had a kidney transplant. So I've actually had my second shot, and I'm very glad you mentioned it, because I was saying, oh my goodness, maybe I shouldn't have had it so soon. But anyway, but what about other high risk conditions like asthma? Do you see that as being safe to wait for 16 weeks? Or I don't know, to say you're hopeful it's going to be less period of time, but.
Yeah, and I do hope that it's going to be less period of time. I'm hopeful that people are going to be able to have it pushed up a little bit. The people for whom I think that it is less safe is people whose immune systems don't work quite that well. And we know that those people that fall into that category are primarily those who are over the age of 80 and those who are receiving immunosuppressive medications. So for transplants like yourself, chemotherapy rather for cancers and things like that. For most other people who have functioning immune systems, I think it actually works pretty well.
Well, it's good to hear. Thank you kindly.
Okay,
Thanks,
I think
Fred.
next question is Ken Medlin had his hands up. Brian Patrick, I see your hand waving, so I'll push it down for next. Save your arm. Ken, if you want to unmute, go ahead and ask the question.
Good morning, Doctor. Thanks for all you do. I have a concern. Several of my dear friends are surgeons, and I've observed them and have told them they're looking very, very tired and stressed these days, with, I'm sure, good cause. What steps are being taken within the medical community to ensure that these very valuable assets are taking care of themselves? I'm concerned about mental condition as well as physical. Is there a monitoring system in place amongst the medical community to ensure that these people are receiving the care they need?
I think that's a really great question, Ken, and I really appreciate that. I think that shows great insight into what it has been like for primarily, yes, for people in my field and for me personally as well. It's been incredibly difficult. The amount of time, yes, but also the amount of what we call kind of moral injury that is inflicted because of some of the conversations we've been having about triaging care and about these sorts of things. It's been tough. And because of this, we have had a lot of networks that have been built, not only amongst physicians, but amongst all healthcare workers at our hospital, and a lot of support from our chief of staff, chiefs of surgery and medicine. There's been a lot of help that's been offered and given to me personally and to a lot of the surgeons. Do keep in mind that with respect primarily to the surgeries, maybe as a bit of a maybe double-edged sword, because a lot of the surgeries have been canceled, there has been a little bit of reprieve, I think, for some of the surgeons. While at the same time, that in and of itself adds some stress to people's lives. There are always 2 surgeons in every surgery and an entire healthcare team. So do rest assured that if anybody does need a surgical procedure, there are a number of checks and balances that are in place to ensure the safety of anybody who is there and ensure the safety of the healthcare team as well. And all of the conversations that we're having at Joe Brandt, but on a higher level as well, with respect to ramping back up surgical procedures and delayed care, all of those conversations go hand in hand with ensuring that people are safe, that people are well rested and in the right mindset. And that is exactly the conversation that we are having as we move forward to reopen at Joe Brandt.
Next questions from Brian Patrick. Brian, you want to mute yourself? Brian, you're still muted. While we're waiting for him to find his unmute, I had a quick question. I have a 2.5-year-old grandson. Do you have any idea when we'll see a vaccine for really young children?
So right now, there are studies that are being done for the various vaccines for Pfizer, Moderna, AstraZeneca, and Johnson & Johnson to look at different pediatric populations. So as you know, they are currently approved, Pfizer is currently approved as young as 12 years of age, but I understand that some of those other studies that are currently being completed are looking at vaccines for those as low as 6 months of age. The caveat to all of that is that I think that it's important to recognize that people below the age of 12 are exceptionally unlikely to have any severe symptoms, if any symptoms at all. So those vaccines, I think before we vaccinate the 6-month to 12-year-old population here in Canada and in kind of G7 countries, I do think those vaccines need to go to low and middle income countries and higher risk individuals there. Because I think as it's been highlighted, especially in outbreaks that are happening around the world, particularly in India, looking at Japan right now, is that this pandemic isn't going to be over here. And it's not going to be over anywhere until it's over everywhere. And access to vaccines is going to become a huge, huge issue over the course of the next 5 years.
Okay.
I can see Brian unmuted himself.
Yeah.
Yes, I finally made it, sorry. One of the things that puzzles me, and I think a lot of people, is the talk of mixing the doses or mixing the vaccines that you can get for your second dose. And my understanding is that the Pfizer and Moderna work a certain way, and that the other vaccines don't necessarily work in the same way. And I guess my concern is, I know there's studies on this, but isn't it ideal to have everyone get the same dose, the second dose?
So I suspected mixing might come up. Thanks for asking that about that, Brian. So yes and no. At a very high level, so Pfizer and Moderna vaccines are what we call mRNA vaccines, where the actual medicinal component is an RNA, which is a blueprint for creating a protein. But after that protein is created in the body, the vaccines actually act very similarly, if not identically, to a traditional vaccine. The big difference really is that we are injecting something that is kind of one step before what we would usually inject. So if you were able to inject, say, a concentration of 100 somethings per milliliter, if we're able to inject 100 mRNAs, you actually get far, far, far more protein out of it than being able to inject 100 pieces of protein, for instance. So you get a stronger immune response as a result of that. And that's actually why people end up so symptomatic. But there is a precedent. There are a lot of vaccines that we combine different brands. Pneumonia vaccines, for instance, we give people a dose of Prevnar and then a dose of Pneumovax, which are two completely different brands, and it actually leads to a stronger immune response. The study out of the United Kingdom that was released last week showed that combining AstraZeneca and Pfizer was A, safe, and B, actually led to a few more side effects, interestingly. And then a press release about a Spanish study was released yesterday, I believe, or the day before, and also looked like it led to, yes, more side effects, B, it was also safe, and C, it appeared to actually have a stronger immune response as well. It seemed to work better. And that's kind of what I would expect. So as we look forward, people that have had their first dose of an AstraZeneca vaccine, I expect will have the option of either getting a second dose with AstraZeneca or a second dose with Pfizer, provided the results of that UK study show the same thing as that Spanish study. There's that opportunity. And I think as we learn more and more about different mixing and matching, we might see a stronger immune response. But the flip side might actually be more side effects and potentially prohibitively so. So we'll have to see.
Dale, I have a couple of questions in the chat. I think you've covered them mostly. I just wonder, we have one from Tom Evans. He's wondering what the plans are for returning to providing surgeries and other hospital required care, which have been seriously delayed. I think you talked somewhat to that. I don't know if you want to address it a bit more.
Yeah, thanks. Maybe just an adjunct to what I've said already is just to keep in mind that surgeries that are urgent, emergent, and primarily surgeries for things like cancers and that sort of thing actually haven't at all stopped. We've continued to operate several operating theaters at Joseph Brant, but around the entire province as well. Additionally, we have continued to provide surgeries up until several weeks ago that wouldn't have required hospitalization, because the limit really wasn't, for a very long time, wasn't healthcare professionals or the surgery itself. It was hospital beds. It was physical space to allow for inpatients to be kept and ICU space. That did wax, and that did change a little bit later on, where we did actually need to redeploy staff members, and that's starting to change back now as well. But just to say, surgeries that needed to be done were still done. And although we have a backlog, we do have a lot of plans that are going to be enacted very soon to allow to work through that backlog. So I have great faith in our ability to do that.
Good. Okay, I'm looking for more hands up. Kevin?
Yeah. Hi there, Dale. Back to the question about mixed doses. My daughter, Neve, who's in her 40s, she got AstraZeneca, and she's sort of an anxious type person, and she's wondering, should she just stay with one dose? You know, because the studies, there's not complete information as to what the side effects are, and you know, if you mix and match. Would she be okay just saying, okay, I've had one shot of AstraZeneca, I didn't get a blood clot, I'm so happy, just kill it right there? Or should she actually, is it important that she get that second shot?
I think that's a really great question, Kevin. It is important that she get a second dose of something. Now, the AstraZeneca doses were actually given, or are planned to be given at a 12-week interval as per the study. So it's a more traditional vaccine. So there's likely still a little bit more time for her to decide. And I think it will allow actually for her to see the more information, the more studies that are going to be coming out over the next, I would say, week or two. So there are going to be, I think, concrete recommendations to that. To bring it back to the clot issue, I know that, frankly, there's been a lot of very, I'm going to say, clumsy messaging around the clots. And what I will say is that we have a number of medications that we've been using for decades that actually cause the same type of clots. We continue to use them. We continue to recognize the risks associated with them, as we do with the AstraZeneca vaccine as well. But I would encourage everybody to remind themselves that, this vaccine has been used worldwide, especially in the United Kingdom, you know, hundreds of millions of times. And the risk is exceptionally low. And but it doesn't belie the point that it is always important to look out for signs and symptoms of adverse events to any medication, including this. So if people are getting their second dose of their AstraZeneca vaccine, to continue to look out for severe headaches, shortness of breath, limb pain, especially that doesn't go away. And if those are the case, go into the hospital, because we know how to treat these blood clots. We know how to look out for them and to test for them and to treat them. And they are treatable, provided they are caught soon enough. So for Neve, Kevin, I think that she will have the option. I expect that she will have the option to do one of two things: either to get a second dose of the AstraZeneca vaccine, which, to reinforce, is safe and a very good idea, and continue to watch for side effects, or likely to have a second dose with the Pfizer vaccine. And if that is the case, I expect that there are probably going to be more fatigue, pain, fevers, chills, things like that after that dose, but that both will likely be options for her.
Okay, thanks, Dale. That was great. I'll tell her all of that.
Okay, we have Jim McDowell has a question. Jim, you want to unmute?
Yeah, I found my cursor. We all know how, Doctor, thank you for all the information you're giving us here, but we all realize now how important the vaccines are. And there is no regime for mandatory vaccination of healthcare workers, particularly in highly congregate areas like long-term care and retirement homes. What's your idea on making employers have a mandatory vaccination program?
It's really hard to do. It's very hard to mandate that. And that's part of the difficulty, I think. At the end of the day, having the vaccine makes it the situation safer for you, for yourself, number one. It probably leads to fewer transmissions of infection. It probably leads to lower vaccine rate or lower infection rates in general. But the most important thing is that it protects you. So the best thing that you can do in any situation, whether you live in a retirement home or long-term care, to protect yourself, frankly, from staff members, is to get vaccinated yourself. And I think that's number one. But that's primarily an employment law question, which is certainly not my area of expertise, but I do understand that it is exceptionally difficult to mandate vaccines for employees and even for students in schools. As you may have heard the Minister of Education articulate, that will not be a prerequisite for re-entering in-person schooling, regardless of my personal opinions, will be to be vaccinated. So it is a bit of a difficult subject, because I would love to be able to mandate that everybody be vaccinated, because it improves everybody's safety. But I recognize that it is difficult, if not impossible, to do.
Good. Dale, I realize you have a hard stop at 11. We've got about 3 or 4 more people with questions. We'll see what we can squeeze in. And if you have to go, wave your hands and we'll get you out of there, okay? Milburn, you had a question?
Yes, thanks, Doctor. How do you see the Joseph Brandt handling the requirement for burnout or requirement for additional personnel to handle a backlog of surgeries or whatever, and make better use of your so-called tent for its original intention to handle actual people, rather than vaccinations, which could be done elsewhere?
Burnout is a large issue, and was before the pandemic as well. Not only is it something that I'm passionate about, but has been something that we've all been talking about within healthcare quite a lot. And I think that we all as a group actually struggle with managing burnout for ourselves and as an organization, not just at Joe Brandt, but across the country, across the world, really. So I know what we've been doing at Joe Brandt is starting the conversation. We've developed, groups, programs, and support groups as well for people to help with burnout. There has been the availability of counseling services a lot, which I know I myself have taken part in and have found very helpful. And sessions like mindfulness, sessions like how to improve your ability to continue to cope with what is an ongoing crisis. And so while I think that it's an ongoing struggle, and I think that we continue to all work on this, I think that it's very much at the forefront of how we all return to what we're calling the new normal. And I think that needs to be built into that.
Okay. Next question is from
portion of the question was, how do you feel they handle the backlog, which probably is going to require additional personnel?
You're right, and probably, hopefully, hiring more staff. Hopefully, that's a possibility to be able to, whether that's hiring more surgeons and nurses, but we also know that, frankly, there are not many, if any, healthcare workers right now that are unemployed. So it's a bit of a strapped industry right now too. It's tough.
Good.
All right, thank you.
Okay, Jim Pressard, sort of.
Jim Shorters.
Sort of things, Jim.
I just want to thank Dr. Kalina for an excellent presentation. And I just want to ask about one other aspect of the whole pandemic, and that is your presentation was certainly focused on vaccines. What about masking?
I think that maybe even later today, actually, we might see some more recommendations from it. But I would expect some of the masking guidelines to wax and wane as they have in the United States and in the United Kingdom, along with vaccine status. So I expect that we will hear things like, if you have had both of your doses of vaccine, you will not be required to wear masks inside other rooms with other people who've also received both doses of their vaccine, for instance. So I'm hopeful that that's the type of step forward that we'll move in. That said, I am actually hoping that masking as needed is something that is here to stay, because I really loved not having any colds over the course of the past year and a half. I'm sure you all did as well. And really the benefit is that if you yourself have a cold, you should be comfortable wearing a mask in public as not to infect other people. And that is and has been commonplace, particularly in Asia, for the past decade or so. And I hope actually that this is something that is seen as community-minded going forward. And I just want to say, I can see that there's a number of questions here as well, and I know we're not going to be able to get through everything. Gary, if there are additional questions that I'm not able to answer today, please feel free to maybe take them down or receive email. I'd be happy to answer them as quickly as I can, perhaps via email, for instance.
Okay. Are you out of time now, Dale, or do you?
I've got.
I got Cliff Baker and Bob Shaw have questions, so we'll see if we can squeeze them in.
Yes, my question is for Dale, Mr. Kalina. The general topic of non-believers and anti-maskers and anti-vaxxers, are there any steps being taken to address that problem? Because it is definitely a large problem, I believe, and I just lost a family member due to the actions of an anti-vaxxer who refused to have an elderly parent vaccinated.
I'm very sorry to hear that, and I have seen a lot of that personally myself, unfortunately. So there are a lot of things that are being done. Yesterday, I actually attended a seminar provided by the Public Health Agency of Canada on addressing that specifically. So I think some of the things that we can all do ourselves is, first of all, get vaccinated ourselves, but second of all, have the opportunity to discuss why. You know, ask questions, understand and meet people where they are. You know, why are you concerned? What are your issues? What fears do you have about vaccines or masks? And to be able to start that conversation in a way that is hopefully more objective will allow for that conversation to move forward. As it's tough, it's difficult, and I think is often, at least in my experience, made worse by everybody's biases, including my own. So it is I think an issue, hopefully of actually not as many people. I think it's more a vocal select few, unfortunately, especially given our vaccine rates here in Halton. But I think opening it up to a constructive conversation and getting vaccinated and protecting yourself is what I would do as first steps.
Are there any programs that might be addressing that, so to address the general population on that?
Yeah, so Public Health Agency of Canada does a lot of programming about that. So does Public Health Ontario, and even the Ministry of Health has some programs and some resources that are available at ontario.ca, and that's what I would encourage you to reach out to.
Thank you for that.
Of course.
Dale, got one last question from Cliff Baker, if he still has a question.
Go for it, Cliff.
Good morning. My question is regarding the variants. And we've heard of all the different variants around the world, India, Britain, etc. And they've obviously been coming into Canada, or supposedly coming into Canada. My question is it possible that some of these mutations are a result of what's happening right here in Canada, as opposed to being transmitted by people coming into the country or into the province through our porous borders?
Yes, so it does. So just to recognizing the time, two quick things that I would say about that is that I do think we actually need to close some of those loopholes to traveling in. The majority of cases are not from travel, but ensuring that we do have strong quarantine measures for anybody who's entering the country by foot, land, or air. I think that it's cumbersome, it's frustrating. I recognize that, and it's expensive, but it is also safer. That said, yes, viruses, including COVID, the one that causes COVID-19, are continually mutating, but the level of mutation is proportionate to the number of reinfections and the amount of virus circulating. So it's less likely to be developing here domestically than it is in the United Kingdom, United States, or India, for instance. But controlling the virus domestically and internationally will help decrease the risk of variants tremendously.
Dale, I think we have to wrap it at this point. Ken, if you want to take over.
Sure. Yeah, thanks, Dr. Kalina. I'd like to throw just one quick comment about the anti-vaxxers, the people resisting vaccination. I think of traffic lights and seatbelts. Both of those were imposed by law for the greater community good and imposes restraints on our personal rights, and that's what legislate. That's what government is supposed to look at. So I just throw that comment out that we accept certain restrictions in our lives for the safety of our community. But anyway, thank you very much. It's been a great presentation, very articulate, and response to our questions. And I'd like to thank you. And I think of all the media barrage of information we've received, you've been able to provide us with a level of sanity and comfort. Thank you very much. And please, you can leave the meeting with our thanks.
Thank you again for having me. I do have to go, but it was great to be here.
Thanks, Dale.
Take care.
Okay, everyone, this program, this presentation and question period has been recorded and will be put up on YouTube in the next few days. And just for your information, to make a note for the next month's meeting is June 17th, same place, same station. And as mentioned earlier, we're going to have Commander Bob Williamson, and he's going to come and talk about some of the ships that sank in Lake Ontario during the naval conflict of the War of 1812 to 1815. So put that in your calendar. What we're going to do now is, as we normally do, is move into breakout rooms, and that's going to be organized by Bob Dickinson in the next few minutes. Please stick around. You can carry on the conversation we've been having here for the last while. So please stick around. Bob will place you, we'll place you into breakout rooms, and thanks very much.
Sorry, can't stick around today.